this month has been all about the lower back. So we're going to talk about some of the poses that we modified. So we started with a quad stretch, and you can come onto your couch cushion or bench or something that works for you. This has a little bit of a cushion, and I like the cushion. Feels better on your knee. So you can be here, and we're keeping the hips even, right? So this is a good option for really, really tight quads, like somebody who has their quads are kind of dominating everything, and they're really tight, and maybe they can't reach their foot, right? So then we can grab the foot, pull it, and the other option too is to grab it with the other hand. I go back and forth because I feel like that has the ability to tweak the knee. If you were to come here, say, and grab it this way with the opposite hand, I think it depends on the person. That's another option. But again, really keeping the hips neutral. And we talked about how we want to maintain that bend in our knees when we're stretching the hamstrings. You can even come to your little bench if that's higher, and we're not engaging the lower back to protect it, but we are modifying to allow it to be manageable in the pose. So we have a nice bend in the knees. We're bending forward, and we're engaging, keeping the spine up. We're not rounding down, keeping it up, coming up. So we also talked about Locust to strengthen the back. So we're coming on to our mat and coming down here. Now we can modify this by keeping the arms down and the feet down. We can do one leg and then the other leg, but we're strengthening the back with that pose. And we talked about lateral flexion to open up those lats, because sometimes what a lot of people don't realize is that when the lats get tight, they tend to make people hunch because it's pulling. And so it's important to take that into consideration. What's happening at the head? What's happening in the thoracic spine? What's happening in the pelvis? Is there, an increased rotation one way or the other? Is there a tilt? Is there a lateral flexion? Is one hip way higher than the other? So these are all things to take into consideration when talking about low back discomfort. So we can be here, and if somebody's really rounded, they're not going to be able to get very far. It's okay. You just start where you are. You laterally flex. We can use a block like we talked about at the wall and laterally flex. So we're putting the hip, the block, right up to the wall and then flexing. I like, again, to keep the pinky rolling out, palm up, because otherwise you're creating a little bit of medial rotation. And I can feel it a much better stretch by rolling my pinky out, palm up. And I think that works better in the human body in general when we're trying to stretch the lats out.